Hello and welcome. Welcome, Dr. Shruthi Acharya, to this humble podcast. All our viewers and listeners are excited and are looking forward to listening to you. Dr. Shruthi Acharya is the professor in oral medicine and radiology at the Manipal College of Dental Sciences, Manipal. And she is here to present and talk to us about a wide array of subjects ranging from core oral medicine radiology, her college experiences, her journey throughout dentistry, and finally to be a founder of a very prestigious company herself. So with this, with no further ado, let's straight dive in to into talking and getting deeper with Dr. Shruthi. Thank you so much for being with us here today, ma'am. We are very privileged to have you, and thank you so much for your time. I hope you had a good day. How was your day today?
It was good. My sister's just come back, so it was fun to be with family today.
Lovely, lovely. Thank you, ma'am. Okay, ma'am. So with this, I want to ask you about your dental career. I would want us to go a little back, maybe a couple of years ago, as to when you were making the decision of choosing BDS as a profession. Can you tell us what led you to that choice?
For me, it was a very clear-cut choice because I had this wonderful orthodontist. So I was studying in Delhi, and I had this proper, class 1 with increased overjet, and I was getting my braces, and we had Dr. Captain Verma actually. So Captain Verma was my orthodontist, and the way I saw myself transform from being bullied and being, sidelined because of my teeth to a very confident and a very clear and, let me take on the world kind of attitude. And I thought I owed that to Captain Verma. So he was a huge inspiration for me. And for me, it was very clear. Here, I write my entrance exam and I need to do my BDS. So what happens is I come from a family of bankers and engineers where we don't have any doctors or dentists. So it was a big question mark, where should we study? So it was because I'm from Karnataka, we had a domicile here. So it was straight cut, Karnataka was confirmed. So we sit in the counseling hall, we are in Bangalore, and my dad is like, okay, let's see. Mangalore, that's my native. So which college is Mangalore? And then we had A.V. Shetty, and then my dad had done some background work about, and I had some distant cousin of mine who was studying there. And they're like, okay, let's study, let's take A.V. Shetty. So it was very simple, kind of straightforward. Gaon mein hai, pass hai, safe hai, let's go and study there. So kind of queries that we get about the background, I wondered. My dad never did that. We were just sitting in the hall, and it was like, okay, let's do this. So that's where I did my BDS from. I'm a UG from A.B. Shetty Memorial Institute of Dental Sciences, Derlakatte, Mangalore. So that was my BDS there. And then during the last year of my last month of my internship, I got married. So it was like, and then I joined as tutor in MCOT's Manipal. So, and when I was doing my tutorship, we wrote our exams and we had the entrance and all that. And then it was one more round of counseling. And that time we had something called a staff quota. So my husband was a reader that time in public health dentistry, and we were eligible for the staff quota. So through the staff quota, we had we were three candidates, and there were 3 seats. So it was prosto, oral surgery, and oral medicine. And I don't like prosto. Somehow I don't like prosto. And oral surgery was like, no ways. I had a baby that time. My son was 11 months old. So, and it was a big daunting task. The baby, can I manage the OT? Can I manage the rounds? So it was very hectic. So then it was like, oral medicine, why not? So it came naturally to me, ki, yaar, chalo, let's do oral medicine. So that's where I did my, so my master's is in oral medicine from Manipal College of Dental Sciences, Manipal. So this is the UG and the PG from me.
Wow, that is really interesting to know, ma'am, because it's very rare for me to actually listen to cases where people take themselves as an experience, as an example, and then take up that profession. Especially off late, I haven't seen a lot of peers, going through and understanding the impact of a profession and then making it their own. So that is really interesting to know about you, ma'am, and especially handling a child, your marriage with internship and with your master's. It's absolutely something to look up to. So that brings us, of course, we understand what led you to choose oral medicine as a specialization. Now, in today's terms, do you think oral medicine is often regarded or it's put under the umbrella of non-clinical dentistry? What is your opinion on the same?
I have a serious issue about classifying something as clinical and non-clinical. I mean, there wouldn't be any dentistry if there were people not knowing how to diagnose anything. So I feel and this happens only in India, surprisingly. If you go on to say oral biology or oral medicine becomes a huge part in any European or even for that matter, US colleges. It's an integrated part, it's a part of your learning. So we don't get classified as non-clinical and clinical. And then there is disparity even in the fees, even in the way it's treated. And they're like, even I believe the exam part is also like, they're non-clinical. There's, be it PhD, be it oral pathology or oral medicine for that matter. I mean, we are working with patients, we are involved with patients. So the classification, I wonder who started this whole, disparity and creating differences on basis of what is also the question. And as far as oral medicine goes, because thankfully in India it's oral medicine and radiology is a huge part of practice. And thanks to the last couple of years of implants, where everybody in the country wants to do implants, and implants without radiology just can't happen. So, and CBCT has come in a big way. The amount of CBCT centers that have opened up across the country is huge number. So I feel, we are a very, we play a very critical role. So more often time, the perception that the students have is, oral specialty mein kya karte hain? I mean, kar hi kya rahe hain? I want the whole fact, I believe it comes from where some colleges do not give that emphasis or do not give the training, where all the soft tissue lesions, all the mucosal lesions, be it lichen planus, leukoplakia, be it pemphigus, I mean, all those management, and these are chronic conditions, very painful conditions. And we monitor it, we identify, diagnose, biopsy, DIF and everything, and then go on to do a long-term follow-up with these patients, the kind of relationship we develop. I mean, I know still patients who come and follow up who I've seen them as PG. I mean, it's been like more than 10 years, but regularly they do come for follow up because of the bond that we have and the treatment that we give. So I believe, it is underrated in India. That would be the thing. And if you cannot diagnose a lesion, if you cannot interpret a radiograph, I believe your dental clinic or your dental practice is not going anywhere. So it's underemphasized and underrated, what I feel.
Absolutely, ma'am. Ma'am, this brings me to my next question. That in the past years, even in MCOS Manipal, we've seen the coming of the CBCT machine, which was bought in around 2016-17. So how was diagnosis now versus when you were learning it 10 years ago, when you were practicing it at the start of your career? How do you think the advancements have come along?
It has made our life easier. It has made visualization simpler, and for a great extent, explaining to the patient has become much more easier. If you ask an oral surgeon, if you have the nerve very close to the root tip, people were doing disimpaction procedures 10 years back, they're doing it now also. But the confidence with which they're doing, the clarity and the explanation that we can give the patient why this procedure is required, because we can show them the picture, we can do a 3D reconstruction and explain to them what exactly happened. So that way, I feel even the patient's confidence as well as clarity and kind of the level of confidence with which an oral surgeon goes to do the procedure has also increased to a great extent. So the third eye, CBCT, yes. And from me personally, the amount of radiation exposure is so much less as compared to CT. And then we have the 3D recon. It's a huge, very important tool where, be it fractures, be it, any kind of cysts or tumors, the visual impact that it has, the patient can understand, okay, something is wrong on the right side of the face as compared to the left side. So that is a huge part. And the confidence with which, I mean, I can give the millimeter kind of, precision there. And not just oral surgeons, I feel endodontists, the great missing canal. I mean, MB2 ko dhund ke pagal ho gaye. So, all that becomes easier. And patient follow-up also becomes easier because of the precision and the, advantage we have. So that way, I mean, I'm grateful that we have this, the tool with us, with which we can serve the patients better.
Right, ma'am, of course. I feel that even in correct diagnosis, I believe that maybe 15, 20 years ago, we were wrongly diagnosing and people were going back home with a completely false diagnosis of their problems. But do you still feel that do you think India's technology is at par with maybe procedures happening around the world when it comes to diagnosis through radiographical methods?
any given day, Sanjana, even if you ask me before I do a CBCT, I would definitely need that IOPA or a panoramic radiograph. And all decent, even if I take for example Udupi, even that we are tier 2, tier 3 cities, and not just Udupi, across India, everybody has that decent machine with which they can do. It's just that the training should be good enough. The the clarity or the what should I say, the scientific basis should be clear enough on which they make the diagnosis. So if you ask me, access to these radiology, is it services, is it difficult? No, probably, and not all cases do require CBCT also. So, so as far as we should be proud Indians that yes, all of us, and these days the chairs do come with the radiology machine. It's not like, you have to separately get. So when all these convenience are there at our fingertips, and we are not using it to the extent. And I believe, so from patient point of view, are the services available? Yes. Okay, do we need CBCT at every nook and corner? Maybe not. And it's on a case-to-case basis where we make the decision like, yeah, this will help me, get me more details. But when you're talking about implants, definitely, I would hands down say that CBCT makes it simpler.
Great, ma'am. Thank you. So, ma'am, with this, if you were to give any sort of suggestions or any sort of head start to anyone taking oral medicine as a specialization in the coming year or next year, what advice would you give them?
I feel if you are passionate about research, if you believe that oral cancer is something that is eating our society away, I believe this is where you need to be, because oral medicine is a huge topic where all kind of research should be happening, all kind of we should be the ones trying to find out the next marker, the next easiest solution, or the next probably targeted cell that we can do for curing cancer. So if you talk from, and thanks to ICMR, which is coming up with huge number of scholarships and grants that are supporting these kind of, base level, basic research, I believe oral medicine can do wonders. And it's not just that, there are many potentially malignant disorders. If I start with OSMF, I believe ours is the highest concentration of this. And OSMF for me is worse than cancer, because patient suffers every day. The burning sensation is there. Patient cannot open the mouth. So if you're looking at targeted kind of treatment, then we have the, the pool, the patients who need our help, and the research that's happening in this field is not enough. So if you're passionate about research, you're passionate about finding some solution for these kind of, morbid conditions which can turn fatal also, then oral medicine is the place to be. To add on that, we also have radiology, and as I mentioned, CBCT is the thing that's happening around. And we need somebody to do the interpretation. It's not always that prosthodontist knows how to figure out where to place and how to do it. So as more and more radiology centers are being opened, and that's where the need is, where we need a radiologist, we need a person with the dental background doing the analysis and interpretation rather than just random radiologists there. So so from research point of view, from radiology services point of view, oral medicine has a huge potential.
Right, ma'am. Lovely. Ma'am, so in your experience of research, are there any eminent institutions or any research organizations or any aids that are present for research that students can, apply for, look forward to if they want to become a part of the research or if they want to just contribute more? Are there any organizations as such?
I wouldn't know about many others, but I understand that many of these at least the top colleges of the country, they have their own websites where they talk about thrust areas or where the research is happening. Like we in Manipal have Pure Portal, which gives you the information about where is the research happening and what kind of funding is coming to that and what kind of grants are being supported on that. So I want the students to be proactive here. When you can do dead scrolling on that, you can as well search for something like something more relevant that can enhance your career and help in your interest. Reach out to the person reach out to the professor, to the doctor who's doing that, and definitely something will work out, because we are also looking for some kind of research fellows, and for that matter, I would say PhD is also a good option. There's a big misconception there. You can do PhD only after masters. No, you can do PhD after your BDS, or you need to have a bachelor's degree. That is the minimum requirement to do PhD. And it's not just abroad, it's also in India. Please understand that every BDS graduate if you're interested in taking up masters, I'm not just talking about masters, I'm talking about straight away PhD. So please look for those avenues where PhDs are sponsored, PhDs are, you can have for full-time and part-time PhDs. So there are a lot of options out there. You just need to search the right window and, reach out to the person, and they can definitely take it forward.
Wow, ma'am, that's actually something that even I did not realize was true, that you can take your PhD even after your bachelor's. Maybe it's just a misconception that's been going on for very
Right.
long. So, ma'am, an inclination towards research, theory, or thesis. With all of such interests, I want to ask you that you made a switch alongside your clinical career with teaching. So, how was the shift, or I would not say shift, the segue from clinical dentistry to teaching dentistry for you?
For me, Sanjana, it was it's a smooth transition, because, as I said, we were part of the where we had a quota system there. We had staff quota, and it was with the understanding that I will continue and serve as assistant professor for so many years. So it was a smooth transition from me completing my masters and then moving on to be as faculty in the department. So, and I'm a Upadhyaya, that's my maiden, and I'm an Acharya, that's my married name. So I believe I was born to do this.
Okay.
So, and the thing that motivates me is the passion and the enthusiasm. I was like, if you can make something easier, better, faster, and make somebody's life even a percentage improvement in this, it's totally worth it. So, and if I have learned something, then I would want my students to do it better than I am. That as a guru and as a teacher, that was the only expectation I have. Yeah, you be better than what I am doing, because the potential is so much. And thanks to all the technology, and as you mentioned, the AI and IoT and all those things coming up in a big way, you definitely are you're in a cusp of an era which is telling you, ki, boss, everything is in your fingertips, literally in your fingertips, and you can make a difference there. So, so when I get up in the morning, be it Monday or a Tuesday, I'm happy to do what I'm doing. So and with that enthusiasm, and I want every student to be. If I am, I keep saying this. If you've seen it in Neville, I see it every day. So come on, get up and examine the patient kinds. So I want people to be more open about it, learn, because learning by doing is much more exciting than just reading that textbook and trying to by heart what the medication is. Because you see, you remember better. And you do, you will remember forever.
Right, ma'am. Absolutely true. We are very lucky to have teachers like you, ma'am. So, ma'am, as a teacher and in your entire teaching experience, you must be seeing all kinds of students. Some are great with their handwork, some are great with their theory knowledge, some are great with their interaction. So, in your opinion, what is one thing or maybe a few features that students should imbibe in order to be successful? And what are some things that they should definitely avoid, in your opinion?
I believe the most important critical thing for me to be, for a student to be having is empathy. You need, when you're a third year student, you're sitting there on the chair trying to get that history right. You need to understand that this person has taken pains, spent money, and has spent a lot of energy and time to be sitting on the chair to tell you his story, because he's in pain or he's in some kind of discomfort. So it's not just a quota or a number that you're going to finish. You're trying to make that person's life better. So if it's Saturday 4:30, then it's your job to give him appropriate antibiotics and painkillers so that the patient can be at least tied over the pain over the weekend, right, till definitive treatment happens. So empathy is something that is very, very critical, I believe. I mean, you should not even think about taking any kind of health sciences for that matter if you feel that, nah, I'm here to make money. And this is one more attitude that I believe you should not walk in thinking that isme paisa hai kya? Where will I get the recognition? But if you work hard, and irrespective of which field it is, things will always, all these things will always follow. So, and the shortcuts, I don't know, off late I have seen our students PPT se padhte hain. And you can't do that. You have mind maps, you have flow charts. I mean, here I would say a big hats off to Palak and her team, who are making up these amazing, easier ways to make the subject interesting and easy to remember. I would say it's a huge challenge. It's no fun. If I ask you what's the prescription to be given and what is the drug dosage, it won't come easily to you. But there are means by which you can organize yourself, get it get it in the go, and start trying to solve and trying to write down and remember, kind of thing. And second thing would be, and because I come from a college where discipline was huge, And we used to be like, why are we being treated like this? And we were rebellious actually. Like, why? What's wrong with these people? And why are they doing this? But now, me coming on this side and me teaching, I understand discipline is so, so important. You need to have a routine. You need to have some kind of goal. Ki, okay, on the weekend, I will have fun for these many hours if I do all this. So, I mean, you have got apps now to tell you, to remind you, to, wake you up in the morning, to, chart out your whole day. So I believe you should use technology to make it easier for you. So work smart, don't work hard. I would say work smart and work hard. That makes it faster and easier to do things. So empathy is important. Some kind of self-discipline is very critical. You cannot expect your mom to get up every day morning and call you to wake you up in your hostel. That's not how a responsible doctor can work, right? So you need to be independent. You need to have some kind of decision making when you sit there. So when I ask you, do I do deep caries management or do I extract this teeth? You should be having a judgment there, informed judgment about which treatment needs to be done. You cannot be like, I'm a third year, I'm trying to figure it out. Right? We have trained you enough. We have given you enough option to do that. So that kind of decision making, kind of discipline and empathy is simply required when you're making a decision. And one more thing, I believe health sciences students should not do is compare it with your engineering friends. Oh, kya hai? Every weekend is so much fun. That's their choice. This is your choice. You're making a difference to somebody's life immediately. Okay, they are also doing it in a roundabout way. I wouldn't discount that. But here you are making a person feel better already, right? So no comparison, work hard and things will figure out. Anything to avoid, I don't know, studying from PPT, I would say.
Lovely, ma'am. That's actually very true because you, at least for any fresh graduates, we understand the impact only once we're out of the bubble. So to get that perspective earlier, the better it is, definitely. So, ma'am, this actually brings me to a very interesting question. On behalf of most students, I would say, as a student, I have, let's say, a small complaint which says along the lines that the Indian BDS curriculum has not changed in the last 40 years. Agreed. So, ma'am, if you were, or if the DCI was supposed to give you a choice to change one or two things about the entire curriculum, what would you choose?
Sanjana, I'm very happy to inform you that finally the DCI has taken steps to adopt the new education policy, the NEP is being thing. We all were part of the team which gave the feedback about, what can be done better. And I'm very happy to say that things that you wanted to do but couldn't do because, no, you are a dental student, you cannot learn an engineering subject, right? All that is a thing of the past. So probably once they enforce the new curriculum, God bless them. And I hope it sounds as exciting on the paper and in reality too, that students can pick topics that are outside their domain, outside their interest. I can probably think about some pharmacy related topic or some engineering related topic as an elective. And I'm scored for that. I'm taught about it. And, it makes it more wholesome. So hopefully when they enforce it, it will work out to be much more better.
Right, ma'am. So, ma'am, do you think that subjects like business and finance, these are places that an average Indian dental student is lacking? And do you think that we can level up and try to get these knowledge from this, maybe the change in guidelines or someplace else?
Absolutely, Ranjana, because I feel that when we teach in school, college or the hospital setup, it's a whole different ball game than what reality is. So if you don't know what a front office management is, you have no idea who is giving the appointments. You have no idea how the payment is happening, through what gateway is happening, who is taking care of it, right? So what's happening, it's a very sheltered kind of environment when you're doing an internship or you're part of the hospital setup, where all this is taken care by some third person. However, the moment you start your own practice, if, as you said, if you do not have the basic background about what a balance sheet is, how do I write my daily entries and how to match it? And not just that, there are a lot of regulatory things that come into play. So private practice is a whole huge thing and becomes very overwhelming. And I believe the students at one point of feel, yeah, why was I not told about this? Why nobody told me this? And it's not complicated. It's just that there's lack of knowledge. There is no connection between you passing out of internship and then you starting a clinic. And that's a huge, and there are a lot of people who will give you so many suggestions and we don't know how to enforce it and how to do about it. So as you said, if you have some background, as we exit the college, it will be a huge help and a big sense of relief. I feel there's so much anxiety related to things that you don't know, and people giving you suggestions. So I feel with the NEP and the DCI updated curriculum, things will become much more smoother and streamlined.
Lovely, ma'am. Ma'am, I feel that any sort of change that even the NEP will bring, it comes with some minds put together, a lot of effort, a lot of time. They must have sat down with their innovative ideas. So with this, I feel that you yourself are such, you hold such a heavy responsibility of innovation, and you have co-founded your own company called Eikona Solutions, and you came up with a very interesting product yourself. So can you please tell us a little more about how you delved into this space, first of all, and then how did you ideate a revolutionary product?
Eikona X happened because it's co-founded by Shruthi and Shruthi. So to start, I think it was 2018, and Dr. Shruthi Singh, she's my partner. She's the co-founder of Eikona X. She was a third-year student, and she was posted in radiology. And she found taking dental X-rays very, very cumbersome. I mean, we kept talking about, please take the outer cancers of the eye and the inner cancers of the eye as your reference, and please rotate the tube head to 30 degrees and take. So she found that very overwhelming and kind of, couldn't figure out. So then she's like, ma'am, can we do something about this? So we had it was one of those hackathon kind of things. It was called Anveshan that time. And she participated in it. And we had this very, ultra basic light and LED kind of thing. And that's how we started. And then she was recognized in that event. And then we reached out to Innovation Center, and they helped us with the initial prototyping and all that. And all this, we are completely clueless. Okay, I think Dr. Lokendra was the innovation in charge at that time, and we had a couple of copyrights and paid design applications that had come through. So at least we were heard कि यार कुछ हो रहा है ऐसे करके. So then we got in touch with the Innovation Center, and initial prototyping, the word prototyping and all that was new to us. So 3D printer had just come, and I mean, it was there, I believe, but we got to see it for the first time and how it works and all that. And then with this prototype, we applied for one more hackathon in NITK Surathkal. So that was a huge game changer for us. And we met so many other people who were doing similar work. We understood how things are happening in NITK Surathkal and what wonderful labs they had, and how much support can be given, and what all things to do, what market research is, because we were under the impression, how many dentists hai? Why should we ask? We know everything. And then our mentor was like, no, what you're making, will somebody buy? And we are like, why will not they buy? It's like, no, madam, there is a market research. Then we understand, oh, market research. I'm supposed to go out, meet 10 different dentists and ask them, is this my problem? Is it your problem too? Right? So we got a lot of insights, we got a lot of mentoring there, a lot of support, and we won that hackathon. So what happened with that hackathon? We got some seed money. With that seed money, we further improved our prototype, and then we applied for something called Biotechnology Ignition Grant. Now that is like a huge thing for us. So we got the Biotechnology Ignition Grant. We are the big 15 grantees, and more money flowed in. We were more confident about our product. Simultaneously, we got mentoring from it's called NSR Cell from IIM Bangalore. So we were part of the healthcare cohort, and that's where, as you said, the words like ROI, and we used to be like, and the speaker, and this was in the thick of Corona, okay, right, COVID, and everything's happening online. Okay, so we are listening, like, okay, and then we're Googling side, mein, ROI kya hota hai? Okay, return on investment. We're like, okay, now we understand. So there was a lot of jargons that were being thrown up on our face, and we come from pure academic. Both of us do not have any business background or any kind of commercial. So it was all new for us. Neither our families nor us, kahan dur dur tak ka nata nahi hai. So we put in a lot of effort to understand all these business model kya hota hai, and what is GTM, go to market, what are we supposed to do, what do you mean by strategies to launch. So all these were new to us, and because of the mentoring that was happening and all the sessions that were related to each other, we put in a real effort. We were very sincere with making those assignments, submitting those assignments and all that. So that was a huge help. Similarly, we got one more mentoring from HexGen, and then followed by Derby Foundation. So all these people have helped us, have sculpted our journey kind of thing. And hard work goes without saying. Yahan pe, there is no replacement. And especially we are in unknown waters. We have no idea where we are going. So we are taking reference from every person. We are asking so many people, ye theek hai, wo theek hai. We are talking to vendors. We are asking codes, which we have never done in our life. We don't even know how to see the codes. And then we go back to the mentor, like, sir, what are we supposed to do? No? How do we interpret this kind of numbers? What do you mean by, all these numbers and all that? So it has been a very exciting journey. I mean, that's what motivating, because for both of us, the why is important, right? So when you ask me why are we doing it, very simple. I want every dentist on this earth to use our product and make their dentistry practice simpler and make it comfortable for the patient. So very clear cut why there. So the only thing that keeps us going and keeps pushing us there is the why. So that's us.
Wow, ma'am, that's quite a journey to know. But that is true. The startup ecosystem is very cohesive, very supportive. So once you enter any system, people will come out to help you, and if not help, to teach you something, definitely. So with that, would you like to share maybe one pitfall and one high point of your entire journey? Maybe one time when you felt that, okay, this was a huge block that you have crossed, a huge thing that you have achieved, and one story of failure, because I feel we do not have the time to commit all the mistakes in the world, so it's better to learn from other people's failure.
Absolutely. But what I would feel is when we started off, so we were very clear that we wanted to make dental X-ray taking simpler, right? And we had a couple of ideas to how to do it. So we realized that one of the biggest roadblocks for us was getting the design right, getting the designer right. So what happened with we were working with NIT. First, we were working with MIT, Manipal. So we were working with amateurs there, and we are like, "Can you do this?" "Nahi, madam, हमारा तो दिवाली का break है." We are like, "Okay." And then they say, "Can we take this forward?" They're like, "No, we have our exams, semester and exam is going on." So then we realized that our work is stuck because we are depending on somebody who's also engaged and committed to something else. Then we moved away, and then we moved on to NITK Suratkal. So they're wonderful people, very good support, very nice. But what happens is they are executing our ideas. So there are no inputs coming from their end. So then our next step, because we got the grant, we could take it further. We got all the mentoring that I was talking about. Then we realized that we should be working with someone who's very professional. So then we reached out to Prudency, and my God, the amount. You should see the aesthetics like a functionality change immensely, because that person gets 30 years of his experience in design making onto the table. So I've realized that academics and professionals are two different ball games, and you should be smart enough to identify what is working for you and what is not working for you, because here the compromise was time. Huge amount of time is getting stretched on a very small fact which could have been fixed easily, kind. And the highs would be, I don't know.
Excuse me, ma'am. I'm sorry. Ma'am, whom did you say you reached out to?
We reached out to a team called Prudency from Bangalore. They are the professional,
yeah. Okay, so it's a professional company. Okay.
Yeah, they are a startup like us. So
okay.
They help with, and they have a huge, a very hardcore design team. So things became smoother, faster, and it was much more streamlined because they're very professionals. They're like, "Okay, ma'am, do you approve? What next?" So now then we understood that working with professionals comes with a cost, definitely a huge cost, but it is much more easier because they are very clear about how they deliver things. So that's how it is. And the high would be, I think the latest one is we got classified as a Class A medical device. So that's a huge regulatory support for us. So this happened 2 days back. So we are on a high there.
That's great, ma'am. Congratulations.
Thank you.
The same. Yes. So of course, regulation and compliance, even when we were getting trained in entrepreneurship, is something that we were told is a very time-consuming process. Lots of paperwork involved, lots of regulation, and of course, very time-consuming with the government. Most work with the government will be time-consuming. So congratulations on that, ma'am. I'm sure that a lot of listeners would reach out to ask more questions, more details as to what is the right way to reach out to the government. Are there better bodies for easier functioning and getting all your paperwork straight right at the first time? So definitely we will, the listeners will be very fortunate to reach out to you on either your company's professional handle or your handle that we will be putting in the description box. So yeah. Yes, ma'am. So that's actually a very interesting journey. What is the way forward? Like, what does the next 6 months look like for Eikona and for the product to come up?
Yeah. So as I said, one regulatory is a huge plus for us. So we are moving into manufacturing in a couple of days actually. So we've done with something called design freeze or something called design for manufacturing kind of stage. So we are looking at marketing and trying to tell the world that here is an easier way to take dental radiographs, be it sensors, RVGs or PSPs. And for us, the bigger USP is that we are going to make it easier for the patient. We have seen how difficult and how uncomfortable the patients feel when they're asked to hold that whole sensor with their finger. It pokes them, it hurts them, and there's a lot of slipping. And then we go on to repeat the radiograph saying that, oh, theek se nahi aaya, fir se karte kind. So we feel that it will be much more comfortable for the patient, and by default, it becomes easy. The whole procedure becomes easier for in the dental setup because it's a win-win situation for the dentist as well as the patient. So we are planning to launch Tarsier X. That's our device in about 6 months' time. Yeah.
Lovely, ma'am. We're looking forward to that. One thing I want to tell, ma'am, even you and our listeners, one thing I picked up is you said one thing that your why is very clear. Off late, of course, I'm very fortunate that universities, colleges, the Indian government, mainly Startup Karnataka, is supporting these ventures so much. This was not happening even 5 years ago. Forget the previous generation. So, of course, I'm very, very fortunate that all of this is happening, but we tend to lose focus of the why in just to be in the race of making something or being a part of something big, new, and upcoming. So, yes, having your why clear is one thing that will take your product to start to finish. And it's very easy to get, like I myself have suffered from getting distracted by a lot of things. So you lose focus of what the company is made for. But yeah, so the right channeling and of course looking up to the right examples of people, entrepreneurs is really helping students be on the right track and reach, if there is the finish line, of course. So I feel that there's a lot to take back from your experience, your journey, and of course, a lot to learn on how to develop something so technical. It is not just a mobile platform, or it's not just a service. It is something that has a lot of technical knowledge that has gone through over the years. So
to add to that, Sanjana, I have immense respect for that BP machine that's there in the lab. Just for the fact that the amount of scrutiny it has undergone, the amount of regulatory clearances. So next time I pick up that instrument or anything, randomly in the clinic, I'll be like, nahi yaar, bahut effort gaya isme. So, once you're on the other side, you understand how difficult and how complicated it is. And everything is there for a reason. I wouldn't negate anything. Patient safety is priority for everybody. So you make something that is, that leaves a mark or makes a difference in someone's life. It's huge. So it's totally worth the effort.
Yes, definitely, ma'am. Yes, ma'am. So I believe that in this very in-depth conversation, we have covered a very long journey, which started from your own treatment to becoming a professional dentist, to becoming a teacher, and now becoming such a successful co-founder of a beautiful company. And I believe that there's a lot to pick up on in this story. And with the further episodes, we'll be unfolding more details and more stories and more lessons, in fact. I thank you so much for coming on this platform for us and being so open and being there for all our viewers. And I hope that all of us learn a lot from this experience and looking forward to more conversations.
Happy to share my experience here. I would be happy to help anybody who, in any way that I can. So I'll just say, get up in the morning, have a positive set of mind, and just go for it. Yeah. Thank you so much to Palak and Sanjana and the team for having me here. It was a pleasure to interact with you. Thank you.